And welcome to GLR Week 2023. My name is Sierra Sanchez, and I am excited to be the webinar producer for our session today. Before we get started, I want to encourage all of you to connect and engage with us on social media. On Twitter, follow us at Reading by Third, and on Facebook and LinkedIn, follow us at Campaign for GLR. Please use the hashtag GLRweek and hashtag Bright Spots Silver Lining to share any thoughts you may have. Before we start, I'd also like to share some housekeeping tips. First, we'd love for you to introduce yourself, so please use the chat box at the bottom of the screen to share your name, city or state, and your organization. Be sure when responding to select both panelists and attendees so that we all know who is here. The webinar is being recorded and live streamed on Facebook. A link to the recording, as well as any slides, resources, and panelist bios, will be sent in a follow-up email to all who registered for this session. Lastly, we'll be posting a brief on-screen evaluation during closing and highly encourage you to respond, as this helps with our commitment to continuous improvement. And again, I'd like to welcome you to GLR Week 2023. This is the second day of our events that we have during the week. Later this afternoon, we'll have another session on locked out of literacy, causes, consequences, and costs. Wednesday, we'll have an invitation-only session at 12:30 Eastern Time, followed by a session on AI-enhanced efficacy. And we'll invite you to wrap up the week with with an exciting doubleheader on Thursday. The first at this 12:30 Eastern time slot on bright spots and groundwork, what's working in communities, followed by a session on global perspectives in post-pandemic academic recovery. Registration and information for these sessions will be posted in the chat box. Additionally, I'd like to call your attention to the many state events that are occurring during GLR Week 2023. We've launched a special website that gives you information to registration, social media handles, and various events that are taking place. That website will also be posted in the chat box now. And joining you now is Becky Miles-Polka, Senior Consultant with the Campaign for Grade Level Reading. Thank you and enjoy the webinar.
Hello, everyone, and welcome today. And we're so happy that you're here to help us continue our GLR Week 2023. I am filling in today for Bonnie Howard, who is unable to be here today, and she sends her deep regards to each and every one of you. Our session today, what happens in one generation or doesn't affects the next, 2-generation strategies for relieving poverty. We are delighted that you have chosen to spend time with us today. And for this session, we've pulled together a powerhouse of national and local leaders to guide our discussion. They will share perspectives, insights, and experiences that will help us better understand the why of a 2-generation approach and the what. What does it look like on the ground? And most important, the difference made, how 2Gen is helping families succeed. And because the campaign, United Way Worldwide, and Ascend are mission aligned in our aspirations for children and families and see community as the heart of this work, we've decided to launch the conversation today and keep it going throughout the year. So stay tuned. We plan to offer a part 2 in September and a part 3 in November. And now it's my pleasure to introduce our panel today. Camille Bousset is the Interim Vice President for Governance Studies and the Director of Race, Prosperity, and Inclusion Initiatives at the Brookings Institution. She, prior to joining Brookings, Bousset was an executive at the World Bank, where she led the World Bank's Financial Inclusion Innovation Arm, and she was the inaugural CEO of the Consumer Financial Protection Bureau's Office of Financial Education, where she was a member of the policy and executive management teams. We have full bios for each of our speakers today, so I'm going to shorten these a little bit, and we'll keep the conversation going. Iola Fortune is the Vice President of the Impact Team at United Way Worldwide. And she provides oversight, strategic guidance, and support to team members managing key initiatives in education, economic mobility, and health. She also leads United Way Worldwide's efforts to support local United Ways to integrate equity into their impact work by developing frameworks, strategies, peer learning, and training opportunities. Becca Bice is the Director of Family Pathways at United Way for Greater Austin, where she works to ensure that all families in Austin are financially stable. She is passionate about the power of collaboration to change the systems that hold people in poverty. And Amy Weber is the Chief Impact Officer for United Way of Greater Cincinnati. She leads United Way's impact strategies focused on ensuring all families in the Greater Cincinnati region have the resources they need to thrive today and in the future. She provides oversight and leadership across signature initiatives in early education, housing, and financial empowerment, and manages community investment strategies. And our moderator is Marjorie Sims, who is the Managing Director at Ascend with the Aspen Institute. Marjorie has more than 20 years of experience in advancing the status of women and families at local, state, national, and international levels, as well as expanding women's roles in leadership positions within philanthropy. The full bios for all of our presenters today will be posted in the chat shortly. And now it's my pleasure to introduce Ralph Smith, the Managing Director of the Campaign for Grade Level Reading. And before founding the campaign, Ralph was Senior Vice President of the Annie E. Casey Foundation. And as he will tell you, he's a recovering law professor. From 1975 to 1997, he sat on the faculty of the Law School of the University of Pennsylvania, teaching corporate law, securities regulations, and education law and policy. But before Ralph comes on, we have a video we'd like to show you. Sierra, if you'll open that up, please.
The notion now that, and the evidence now, that getting kids able to read at 3rd grade is now not only a report that we can read and study and talk about, it's actually a call to action.
Thank you so much, Sierra. And Ralph, I'm going to turn it over to you.
Thank you, Becky. Thank you. You know, that clip is a great reminder of what we could not have known that day in May 2010, when Stacy Stewart represented United Way Worldwide in releasing the Kids Count Early Warning Report. That early warning report concluded with the call for action that was the impetus for launching the campaign for grade level reading. We could not have known then what we know now. United Ways would become catalysts and leaders and members and champions of the sponsoring coalition in the majority of communities in the Campaign for Grade Level Readings Community Network. And in many respects, United Ways would form a mission critical resource for the campaign and for the field. I was pleased to have the opportunity to report this to Angela Williams, CEO of United Way Worldwide, and was even more pleased and simply delighted when she reciprocated with a strong endorsement for continuing to pursue building this partnership into an even more valuable and important resource to the field. She was excited about this work and committed to support it. You know, given all that, it is so appropriate that this session during GLR Week 2023 will launch a new aspect of our relationship, which is attending to the urgent need to name, confront, and seek to implement actionable solutions to the poverty-related challenges faced by so many families. This series is an exciting and essential next step for this partnership. You know, and I am so delighted that as we launch this series, we're joined today by Ayola Fortune, who leads the impact team for United Way Worldwide. For most of the past decade, Ayola has been the liaison, the navigator, the patient translator, really the glue holding the national partnership together. Both sides, both partners are grateful beneficiaries of her work, of her patience, of her brilliance, and of her willingness to go the extra mile to make sure that we hear each other, listen to each other, and find ways to be stronger together. And I encourage you to take a look at the campaign's civic action and advocacy agenda for 2023 to 2026. And what United Ways will find in that agenda are the things that we have learned from and learned with United Ways across the nation. You've taught us a whole lot. You have been there when we've needed you. You've become the backbone in many respects of the campaign for grade level reading. And this session confirms that, affirms that, and launches the next chapter. And nobody deserves more credit for that than Ayola Fortune. Ayola?
Thank you so much, Ralph, for those gracious remarks. I'm humbled by them and so appreciative of the partnership, the strength of the partnership that we've built over these many years. So I'm very gratified to be here today. I want to welcome everybody to today's conversation. It's a critical one. For those of you attending Grade Level Reading Week, I hope that it's going well, and we're so pleased to be part of it, as we have been and will continue to be. I'm pleased to be joining you today because, as Ralph knows, we've been proud partners in the campaign for grade level reading for the last decade plus. And that longevity speaks to how important this work is, how critical it is, and how much it aligns to the core work of United Ways globally, United Ways within the US and across our network globally. As you may know, the many United Ways joining us and many of our community partners and funders, we work across the key areas that have the greatest impact on people's lives: the ability to access a quality education that begins in early childhood and continues through ensuring that young people graduate high school with the knowledge, skills, and educations for college and career, that people have access to the critical healthcare services and social services and live in environments that enable them to live healthy lives. And the ability for everybody to have economic stability and opportunity, the opportunity to have mobility in your life and to obtain jobs that pay a living wage with benefits that enable people to sustain themselves and their families. And that we're doing that in ways that not acknowledge the different starting points of people, that we're not all starting from the same place with a level playing field. And we have to be especially attuned to those who are furthest away from those outcomes and work actively and with intention to close those gaps and disparities as an integral part of our work. And we know that the ability to read by the end of third grade and into fourth grade is so integral for the life opportunities and fortunes for young people in this country and around the world. And that's why it's such a linchpin of the work that we do and why the campaign has been such a critical partner for us. But it's also because we take that holistic approach, as you see by our global impact agenda on the screen, that we work across all of those issues, because those are the issues that people experience in their everyday lives. And how we do that work is also a core principle of the campaign. We have a network of over 1,000 United Ways that we know how to convene and work across sectors, that we know the importance of building deep relationships that span the nonprofit sector, the corporate sector, and government. And our ability to convene cross-sector and advance holistic approaches to change is what is essential. And so it's important that we are, showing up in terms of helping to lead and support critical partnerships around those issues. And so you see this evident in the 200 plus United Ways that you saw on that map that are leading and supporting grade level reading campaigns in their communities. We also see it in efforts that United Ways are leading related to community schools, to cradle to career initiatives, school attendance efforts, health coalitions, and the 2-gen approaches that will be the focus of today's webinar. We'll hear from our colleagues from 2 local United Ways. And so it's the knowledge of that issues that impact individuals and families, especially families who are low income and living in poverty, and the day-to-day challenges that presents. They are fundamentally interconnected, and that we need to work cross-sector to achieve the lasting change that is essential to change the trajectory for people and for their families. And so welcome again. I hope you find the discussion enlightening. I'm looking forward to, I know we've got a great agenda for you. And most importantly, I hope that you find it actionable and informative for your work in terms of how do we continue to push and to offer those integrated, holistic solutions for the communities that we serve. And so with that, I will turn it over to Camille. Camille?
Ayla, thank you so much. That was a great introduction from all of you, from both you and Ralph. Good afternoon, everyone. I'm absolutely thrilled to be here with all of you, and I'm really looking forward to a very stimulating discussion at the tail end of this meeting. I just have to start off by saying I have an immense respect for the kind of work that all of you do as community partners, as funders, across all of our United Ways, obviously for the 2-gen approach, which I think is really quite pioneering, and of course, all the work that you do at grade level reading. And so thank you for the invitation to join you. So the question that I think, that is on the minds of all of us who work every day to ensure that the families we care about are actually thriving is, how do we rise above improvements at the margins? And in particular, how do we ensure that what we are doing is transformational? And so what I want to do today is talk a little bit about a way of framing the kind of work that we do. So when people like us think about really being really innovative, we think about changing and in some cases eliminating the systems that constrain us and constrain our families. And I know that all of us are engaging in work that we do, knowing that the current system, and I define a system as a set of values supported by policies, practices, and norms, a system like ours here in the US that assumes there is a hierarchy in human value based upon race, ethnicity, gender, or cultural reference points is such a corrosive point of departure that literally anything that's built upon it is bound to be flawed and problematic. So all of us, I think, are engaged in figuring out, how do we fix the system? And I think fixing the system is laudable and hard work, but I think where we really want to be is changing the system. So transformation means changing essentially the set of values from which our policies, practices, and norms depart. And if we have a system now which assumes a hierarchy of human value based on identity, and therefore to a large extent on place, to change that system, we have to imagine and embrace a very different point of departure, which really means a very different set of values. I know that for many of us, this transformation point of departure is the concept of equity. So providing the resources to get everyone to the point where they can approach life and their aspirations on equal footing. And I love and embrace the intention and spirit of equity. And what I want to do with you today is really give texture to what we mean by equity and how we might be able to measure that. And I'm really looking forward to your feedback on this. So I'm going to ask you to engage in a bit of a thought experiment. So I'm going to ask you, if we were to live in an equitable US, what would that look like? What would be the indicators of an equitable US? Now, I'm sure many of us would say, well, there would be no homelessness, no poverty, no disparities that are linked to race, socioeconomic status, gender, or place, as an example. And I think that's right. That framing helps us think about equity as the absence of negative outcomes. But I also think imagining something different pushes us to change that framing and think about how to describe the absence of bad outcomes in a positive way. And so I think it's possible to think about the absence of bad outcomes as the presence or experience of well-being. So the kinds of positive outcomes that we work toward every day, the type of equitable US we are working toward, is ultimately one in which families, regardless of identity or place, would be able to experience well-being. So what are the assumptions we would have to embrace to consider well-being as the ultimate measure of an equitable society? So in my view, there are three essential assumptions that would allow us to start thinking about how to use well-being as a motivator for systems change. First, we would depart from our current set of societal values that reference a hierarchy of human value based on identity and place. And instead, we would start from a human rights doctrine that experiencing well-being is a human right. Second, we would also embrace the idea that families, regardless of their starting point, are entitled to resources that allow them to experience well-being. And third, it will be important that there is a societal commitment to ensuring this basic human right to experiencing well-being. So I hope everybody is with me so far. So you're probably wondering, what are the indicators of well-being? And I have a couple of answers to that. But first, I wanted to just provide a little bit of a caveat, which is that, when we talk about the ultimate outcome of all of our efforts, whether it be grade level reading or the work that we do at United Way or as a funder or as a community partner, we want to make sure that our families tell us what they think the indicators of well-being are. So right now I'm engaged in a project to have families lead that discussion about what it means to experience well-being. And I don't know what's going to come from that, but if I had to make some guesses, I would expect at least the following 5 elements to be important to experiencing well-being. First, strong social connections within and between communities. Second, a sense of purpose, possibility, and agency. Third, an affirming living environment that enables families to thrive. So likely affordable, safe, attractive housing with easy access to green spaces as an example. Fourth, sufficient income to cover daily expenses, save for emergencies, do the extra things that make life worth living. And finally, fifth, children achieving the milestones associated with healthy psychosocial, intellectual, and physical development. So the question is, how do we get to a point where we assume that experiencing well-being is a human right? So there's where I think I'm really, really bullish. I mean, right here in this kind of virtual space, all of us assembled across the country, we have the very people who could pioneer systems change. And you are all in an excellent position to catalyze transformational change. And so how do we do that from the perches that we occupy? So first, we can use or invest in approaches that elevate well-being as an outcome. If other outcomes are proposed, we can ask questions and try to link those other outcomes to a more holistic idea of well-being. So that's first. Second, we can seek out opportunities to change existing patterns of social connections so that there are more and more frequent connections, particularly across differences. And this is, as an example, is not just using a mentoring program, but it might mean exploring programs or approaches that have a clear methodology for ensuring that kids from diverse backgrounds, different backgrounds, mix in meaningful and sustained ways. And programs that are intentional about creating more heterogeneous social networks would be ideal. Third, we want to prioritize programs that are about equipping our families with the same knowledge, information, and resources that more affluent families have. So an example of that would be sharing research about child development, about the various stages of child development and how we can support children as they go through these various stages, and what our plans might be for families, with families to support that child development. So that's an example. Fourth, we need to support programs like universal basic income that do promote family agency, choice over how to use your resources, and also supporting programs that work in conjunction with counties and with those counties and municipalities that are at the forefront of promoting policies for residential interconnectedness across socioeconomic status and across varying identities. There's a lot of communities who are really thinking about how to be innovative to make sure that we don't have residential segregation, and we want to be able to work with those kind of municipalities. So all of us can start, I think, from a vision of well-being to pursue approaches that are intentional about either promoting social connectedness across communities, promoting a living environment that allows families to thrive and children to reach all the milestones of normal development. And I think we do that understanding that well-being is a human right. And I think we can all be part of embracing and advocating for well-being in our communities. I'm going to stop there. I'm happy to take questions and just be part of the general discussion. And with that, I'm going to turn things over to Marjorie.
Thank you so much, Camille. I am so deeply respectful of your work. You always bring such a strong frame, taking us all up another level to think about how to support families, and deeply love the human rights framework and the person-centered or family-centered frame. So thank you for that. And also thank you to the Campaign for Grade Level Reading and United Way Worldwide for inviting us to be a part of this conversation. I'm so excited to be able to share with you all the two-generation approach, but looking at the chat in the introductions, I saw so many of our network partners that are part of Ascend. So Agape in Tennessee, and Stepping Stone in Arizona, and Faces in California, and the Institute for Women's Policy Research here in DC. You know, I saw your name, so thank you for joining, and it's nice to see that overlap. What I'm going to do in the next 10 minutes is to give an overview of the two-generation approach, and then set it up for a conversation that we can go deeper with two United Ways that are within the Ascend network. So first, a little bit about the Aspen Institute and Ascend, and if you could go to the next slide. What the Aspen Institute is centered on is a free and just society. What we do most often across the country is bring people together for critical societal issues. We are a space of ideas and innovations and solutions that people can take action on to move towards a just and equitable society. And the next slide is about Ascend at the Aspen Institute. We were founded about 12 years ago by Ann Mosley, who is our executive director, and she's also a vice president at the Aspen Institute. She came to the Institute with an idea about making certain that we could change the discourse in our country about how you better support the entire family. So we take a 2-generation approach to making certain that families have greater economic mobility across generations. So we're aiming at the well-being of all families, working with both children and the adults in their lives simultaneously. We have a leadership program that is comprised of fellows across the country, 120 of them now. They all are sitting on large levers of change, and they are at the forefront of economic mobility strategies and innovations for families. We also have a national network. I'll share more about that later, but our work really is to move everyone's ideas at the practice level, at the systems change level towards, our North Star, which is economic mobility for families. And in the next slide, you'll just see, I won't go through this, our values. And, it's always about, working collaboratively, moving those ideas and innovations, but always centering families in our work, which is what Camille talked about. And in the next slide, you'll see our theory of policy and systems change. We believe very strongly that all work, regardless if it's a program or a policy, should start with the voices and recommendations of families. Then you layer in data, research, and evidence, and then best and promising practice before you start to shape those policies for children and families. Have to have leadership and political will that then will drive those systems and policy changes on behalf of families. And in the next slide, we'll start to go through what are the specifics around a 2-generation approach. And again, this approach is about a North Star of intergenerational family prosperity and well-being. And in the next slide, we shared this graphic often because we want people to know what that North Star is, how you achieve it, and what our current systems look like. So 2-generation approaches build family well-being by intentionally and simultaneously working with children and the adults in their lives together. That sentence, we worked with the Frameworks Institute to share with our network about what the goal is and how you get there. This graphic is an illustration of how our current, policies and programs are established, what they look like for families. On one end, you have child-focused programs, and on the other end, you have parent-focused programs. Our work is to move towards that center, supporting the entire family at the same time. And in the next slide, what you'll see is just evolution of 2-generation approaches in the United States. We want to acknowledge that 2-generation approaches are inherent in Indigenous communities here and around the globe. So the concept of supporting a family holistically is intuitive. It's what we would all think of if there was a family in our community that had a crisis. We would want to support that family. We would not simply go to the family and say, we'll help your kids. It's the entire family that we're trying to support. But over the years, it has emerged really intentionally at the federal level through the Head Start program is recognized as the first, iteration of 2-generation approaches at the federal level, supporting both children and early learning and the parent through career development. And then over the years, what we have recognized is that, working in communities where you have to contextualize this, often 2-generation approaches, have different names. And we embrace those various names as long as the approach is aiming at the same thing. So here you have some examples of what it's called in different communities, whole family approach, 2-gen approach, multifamily, intergenerational approach, or an example where it's really culturally, contextualized. In Hawaii, it's called a Hana Nui. So lots of names, but one approach, all moving towards economic mobility for families. And in the next slide, what you'll see are the core components. And I love that someone put in the chat, the notion of, what is social capital and how do you do that well? These core components of two-generation approaches reflect everything that all families need to thrive, right? So when you think about your own family, the families that you work with, these are the opportunities to support them through a two-generation approach, moving families towards economic mobility. And what we also understand is that each one of these represents a system or a platform for taking a two-generation approach. So you can use as a starting point an early childhood learning center as a starting point for two-generation approaches, or you could use a community college as a starting point. The first process that you need to take is, who is the family that you're working with? Even though one person may walk into your door, what are the dynamics of that family? And if you go to the next slide, thank you. Just want to share with you some of the research behind two-generation approaches. The one that we pull out most often is the first one that's listed here. And this is research that's been done by Dr. James Heckman, who's a Nobel laureate and has worked, to assess, early care programs that provided comprehensive wraparound services for families. And we found that there's actually a 13% return on investments when you support families holistically. So it's not just strong outcomes for that family, it's strong outcomes for the children in that family and the children of those children. So 30 years of research that supports, working with families holistically. And in the next slide, I just want to ground everyone in the core principles. This should be the starting point when you're taking a two-generation approach, meaning that at the highest level, you're doing all of these things. If it's a practice or a policy or within a system, you want to make certain that you're focused on these 5 guiding principles and making certain that you're accounting for outcomes for both children and their parents together is one that distinguishes two-generation approaches, because the other 4 could be strong, principles for any program or policy. Again, the North Star is, economic mobility for the family, not an individual member of the family. And in the next slide, I want to share with you that two-generation approaches occur along a continuum. And we really wanted to be intentional at the national level of letting people know that it's a journey that organizations go on to get to a higher level of implementing a two-generation approach, and making certain that all of this work is embedded in the voices and experiences and recommendations of families, and that all organizations have the cultural competency to do this work really well. So the first thing, that you need to do is develop a new mindset for working with families holistically. And then the next level would be a strategy where you're intentionally, as an organization, working with others throughout your community to make certain that families are supported holistically. And the example would be if you're in an early care system, and then you partner with a community college. But at the highest level of taking a two-generation approach, it really means that you have the internal systems and structures and policies to support families holistically. And in the next slide, I'm going to kind of quickly go through these. We've developed this continuum of what it looks like at the community level, moving from assessing whether or not your community is really aware of a two-generation approach, and then at its highest level where there's community accountability around two-generation approaches. And in the next slide, I want to start sharing with you just some of the learnings that have occurred over the last 10 years as we've implemented this, modern era of a two-generation approach is that, integration really matters. The quality of your programs and policies really matters, and how you work with families really matters. And and these are just, some snapshots of some of the publications that we've, released. And in the next slide, a lot of information, so I'm going kind of quickly because I know the heart of this is around, the conversation with our United Ways. There's strong bipartisan public support for two-generation approaches. We've polled this, over the last 12 years. And when you get to this percentage of supports, our, researcher says that it's an inherent value that Americans have, that you need to support families, holistically, both children and their parents together. And in the next slide, thank you for managing the slides, some challenges. And I'm not going to go through these right now. We can come back to them through the Q&A, and maybe Amy and Becca have some things to share here. But just know that you have to be intentional about this work, and you will face challenges, but there's also opportunities. And the next slide, just highlighting for you the Ascend network. I mentioned that we have a national network. And the next slide, you'll see what that looks like, kind of across the country. We have, over 520 network partners. We have 120 fellows. We also have had organizations from other countries join. It's a very vibrant network, and we welcome anyone to join. And in the next slide, I believe I actually have a listing of all of the United Ways that are a part of the Ascend network. And we actually hosted a learning community a few years ago for United Ways that were really interested in deepening their two-generation approaches. And in the next couple of slides, I just want to share with you that there are federal opportunities for advancing two-generation approaches, funding opportunities, as well as alignment. There's the Economic Empowerment Act that's been introduced by Senators Heinrich and Collins over the last 4 Congresses, and funding opportunities like the Health Professions Opportunities Grant have been ways in which organizations have tapped in to strengthen their two-generation approaches. And then we had a General Accounting Office report. And in the next slide, I just want to land on, again, the work is about supporting families holistically. We share this quote a lot from one of our parent advisors. She said, just don't meet us where we are. Please meet us where we dream. And that is what this work really is about, centering the voices of families, taking a human-centered design approach and looking to drive towards a broader framework for, a human rights framework in this work about economic mobility for families. So with that, I will now turn it over to Becca, who is with the United Way for Greater Austin, and she will share the terrific work that they've been doing. So thank you so much.
Thank you, Marjorie. Hi, everyone. It's good to be here today. Thank you all for having me. As Marjorie said, I'm Becca Weiss. I am the Director of Family Pathways at United Way for Greater Austin. And if we go to the next slide, I can give a little more detail about our United Way. So we serve the city of Austin, Texas, as well as 2 counties that are surrounding and in the city. We are a fairly large United Way, so we have over 100 staff. That does include the staff that run our 211 line here in Texas. So that's about 1/3 of our staff, but we are a large United Way. And as far as some information about the community that we serve here, we know we have around 25,000 children under 6 living in Travis County, which is the main county in the city of Austin, who are living in households with low income, which is about 28% of those children. We know that 90% of those children are children of color. We also know that Austin is getting much more expensive. Austin is growing, and we know that childcare costs in some areas are higher than college tuition. So these are just some of the issues that are really front of mind for our work here in Austin. And one of the ways that we are working to combat poverty in our region is through the 2-gen approach. So we put together back in 2017. So if you want to go to the next slide, we were very lucky to have one of our community partners from the University of Texas, Dr. Christopher King, be part of the first Aspen Ascend Network Fellows. He brought the idea of 2Gen to us here in Austin, and in 2018, United Way brought together service providers, system leaders, academics, and parents to draft a community-wide strategic plan that provided a roadmap for creating an ecosystem of 2Gen supports in Greater Austin. And you can see here on the screen some of the goals that we have centered in that 2018 to 2023 strategic plan. That coalition is one of the main ways that we're doing 2Gen here in Austin. It survives to this day. We have about 70 entities, so that could be community organizations, businesses, institutions of higher education, public agencies, interacting and engaging with this coalition. And we have about 30 of those partners really actively working on the agenda through work groups or through other teams as part of this plan. In addition to our coalition, we also began investing back in 2018 in 2Gen programs in Austin through our grant making. And we also partnered with community organizations and the community college to pilot a few 2Gen interventions, which includes guaranteed income and child savings account, and looking more into how we can make sure we're helping families with tax credits. And all of that work is in part with partners here in Austin. So one of the things that I think is really important, and I know is really important, since we are an early adopter of 2Gen work, is to be really transparent with the reality of this work. And I put this table up here because I wanted to demonstrate where we thought this work is going so that I can talk about where it actually went. And if you look at these numbers here, these are the metrics that we set out to collect back in 2018 when we drafted our strategic plan and launched this community coalition. And as you can see on paper and through this particular structure, it doesn't really look like we're making that much impact. We haven't seen the numbers budge too much. There is some context here. We all know that the COVID-19 pandemic hit, and it hit us pretty early on in this implementation. But the reason why I transparently offer these findings is because one of the things that we learned through doing our coalition work is that we did make progress. We just didn't make progress in the ways that we thought we were going to make progress. We were really focused on building out 2Gen programs, which are really expensive, as I'm sure many of you who run 2Gen programs or work with 2Gen programs know. And instead, what we saw from our work was not that the number of programs grew, but that the system itself started to shift. So on the next slide, I want to offer some alternate findings that we gathered after doing this work for 4 or 5 years. A few of the system shifts that we've seen here in Austin is that we launched Connect ATX, which is a really wonderful online database and navigation portal for folks to find services in all the 2Gen areas in their community. We have found that other community coalitions, some of them or many of them facilitated by our United Way, are addressing whole families. And that has been a pretty solid shift since we started the 2Gen work back in 2018. So our Early Childhood Coalition is thinking more about parents, and our Grade Level Reading Coalition is thinking about parents as well. Model Community is a new coalition that has launched that's focused on matching social determinants of health with health providers and the health network, all with a whole family approach. Big system players, our community college is working with Generation Hope to focus on parenting students. Travis County is matching workforce and childcare data, and our workforce boards are working to bridge the gap between their workforce supports and services and their childcare services. And I offer this up as an example of what we mean by system shifts. And I also want to celebrate that even if these are things that our coalition didn't set out from the beginning to say, this is what we want to see change, these are absolutely ripple effects of the coalition's work, and the folks who implemented this work and this shifts were part of our network. And so I want to celebrate that this is what this change can look like I also want to celebrate our partners who are running TUGEN programs who have been with us for a long time. These are just a few of the things on the screen that they have taken on and the changes that they've made to get closer to TUGEN. And I'll end with some lessons learned as we look forward. I don't know if any of you noticed, but our current strategic plan does end this year. So we are strategic planning and looking forward to the next 3, 5, 10 years of TUGEN in Austin. Some of the things that we are taking into account next time is that we had this really big, beautiful TUGEN plan that is a great document that we keep. But to really be effective, we need to focus on just a few concise strategies. We have made a little bit of a shift from programs and partnerships. Having all programs and partnerships need to serve parents and children simultaneously, and really opening that idea of TUGEN to think about our goals being parents gaining economic stability and organizations being family focused. Moving forward, we want to be better with our metrics. We want to track metrics that are going to help us learn what's happening in the community, and not only for the purpose of making the work look good, even though it is really great work. And we want to reach those that are not being served. One of the things that we've noted through our work is that only 8% of families in Austin, still with all our work, are being served through a TUGEN program. And so that's something that's top of mind for us. And finally, we want to capitalize on the strengths throughout our community and make sure that we're collaborating with those other community coalitions, those other institutions, those other public agencies that have really moved into the TUGEN space over the past several years. And I'm going to turn it over to Amy, I believe, to talk about Cincinnati.
Great, thank you. Yeah, I want to share a little bit about our journey as well with TUGEN, and some of this will echo a little bit about what Becca was just sharing. Real quick, just again, context setting for Greater Cincinnati is that we, on the next slide, you'll see our footprint. We uniquely sit sort of in a tri-state area that covers the 9-county footprint of West Ohio, which has a very large urban metro region out into parts that are much more rural. Northern Kentucky, again, similar, lots of little municipalities into more rural community, and then 2 counties in southeast Indiana. And, United Way, I think we all have a lot in common, where we often have a mission or vision that are around making our communities better and thriving, and doing that really through our superpowers of uniting others and really creating positive momentum and recognizing that we can't do it alone. So the next slide shouldn't surprise you that we have some key strategies around how do we take action, and that's the convening that we do, the active network building that we do, our grant making and investing in programs and partnerships and solutions is really important. And clearly, a connection to advocacy is also really important. And our focus areas, sort of as Becca was saying, while we have a very large vision to make families thrive, we have to really say, where are we playing in ways to make specific systems changes? And we're really focusing on educational success, most connected to early education, housing security, really looking at housing stabilization and home ownership, and financial empowerment. How are we really breaking down structural barriers that are holding families back from having the resources they need, not only to meet their basic needs, but ultimately to thrive now and pass that wealth down to the next generation. So this slide shares a little bit about our journey as we have really embraced TUGEN, not just as a strategy, but I would say a guiding principle and value in our work. In the early 2000s, we created an agenda for community impact to help us get more laser focused on our grant making, but came very much from a we know best position, right? So we tapped into community experts. Many of those were research and subject matter expertise. We tapped into national experts and think tanks to really say, these are the strategies that we want to invest in. These are the specific outcomes that are best practice. Show us how you align. And so that helped us begin to align our community partners and our grant making in sort of funding streams. In 2010, we actually then created the bold goals, which were community level goals around critical milestones that still are important, and embraced a collective impact approach, which was good, but really created silo incremental improvement. And then went about a very traditional way later on of saying, we're going to make 2Gen RFP priority. And along that process of really that was focused on our grant making, off to the side in one of these projects I was closely engaged with, we were doing pretty creative work. We were applying human-centered design thinking with community partners in sort of really small, deep learning experiences together to innovate and listen to community to better understand their needs and improve upon services and even come up with new solutions. We were working closely with our hospital locally, Cincinnati Children's Hospital, to embrace a specific model for improvement, some CQI practices to use data in different ways to inform improvements. We became part of the Ascend network and worked closely as part of a national grant, a national sort of community of practice to apply 2Gen to really blend workforce development and quality early education. And we started doing some work around systems thinking. And so all of this was sort of happening off to the side, and we saw really cool ways that was, stories of change that we hadn't seen necessarily through our grant making alone. And ultimately really challenged ourselves to say, how do we take these learnings and apply it more globally across all of our impact strategies? So on the next slide, you'll sort of see a little bit of that evolution. These are names that if you visit our website and take a look, and I'll drop a link, you'll be able to see some of the documents and learnings that came out of it. But as we took that step to really say, how do we embrace this more, on a more regular basis, not just in small projects off to the side, but really incorporate it into everything we do. We had some key learnings, right? And I mentioned this earlier. We started out with a very traditional RFP and found, to our surprise, that all of our community partners were 2Gen, right? Because they were really talented at being able to respond to RFPs. So we knew that wasn't quite it, just putting it in as a requirement. And our next evolution was what we called was a funding process. We said, we're going to call for partners that may be doing this or they may not, but they want to be part of a learning journey, and really set up in 2018 a learning experience that met partners where they were. They self-selected into different sort of learning communities, and we structured those learning communities with capacity supports to either apply human-centered design thinking, to apply that continuous improvement or that systems thinking to be able to accelerate their work. And we had good learnings in that, right? It was a large portfolio, nearly 150 community partners. So we needed to really recognize that we went too big, too fast. And so instead adapted to really saying, let's remove some of the structure and really build networks where partners can opt in as they come along. And at the same time, we were doing some really cool work in our equity space of having community design the actual solution themselves through a human-centered design process. So our Black-led social change initiative sprung out of that, and a specific grant-making process that's really focused on Black social change makers and grassroots organizations. That's called Black Empowerment Works, where community is actually the decider of the grants. So our most recent iteration of really embedding 2Gen in our work is making it a value, sort of a core principle that partners have to demonstrate and show. But instead of focusing on the programmatic work, we've really said to community partners, we want you to come to the table and work together in collaborative ways that really get at those root causes that are holding families back. So we're in the process right now, engaging really deeply with community partners in designing sort of their own solutions together and helping them test that And we brought in community voice into that process as well by, instead of us deciding the agenda in which we funded to, we surveyed and talked to sort of one-on-one and in small focus groups, 1,000 residents to be able to give their input on what those top community issues were and convene partners around that. So I have a couple insights too. I won't talk through all of them. But over sort of these are high points as I was reflecting on that again, 2Gen is really a key principle in our approach to addressing family and economic well-being, because we can't just support adults if we're not thinking about the future well-being of the next generation. So one more slide forward. You'll see this is our portfolio strategies. So again, so this is that just lens. It sort of is layered over it all, and we're blending them all together. And then the last slide here, if we slide forward, is some key insights for me. So just recognizing that, and I'm sharing our evolution to say we didn't get it right on the first try, but really did set that vision and have been continuously focused on refining our theory of change, and monitoring that pace and really celebrating that progress, to recognize that this, for us in particular, the change couldn't have happened just in the impact team. We had to bring the organization along to think about our other practices as a united way. We had to think about our board, about our sector, about our community partners. The third one is around embracing complexity. You can't necessarily have a perfect roadmap for this. You have to be adaptive, as Becca was sharing, and there are really good tools to help you sort of embrace that complexity and sort of run with the emergence that comes out of it. It can be really exciting. I always say that the work moves at the pace of relationships, and that matters a lot, especially our United Way has a history of more than 100 years and a very traditional history of grant making and sort of that past as being a community chest. So we have to recognize that that means that there's a lot of inherent power dynamics in our relationships with community and community partners. And it takes a lot of intentionality to cultivate different relationships and move them along. Again, that discomfort of not knowing all the answers, but creating space to learn and grow together. It's really about the how. And I think that gets us to the what around changes in the systems and the sector. And I always say feedback's a gift. So I think with any type of change, you'll get feedback, and it's important to consider that at all levels. And the last thing is, I would just say that the little wins matter. So similar as Becca shared around that success looked differently. 10 years ago, many of our community partners had never heard of human-centered design and did not have practices of even regularly connecting with the communities in which they serve to ask them what they needed, to engage them in solutions. And we've seen that be adopted as a fairly standard practice in our region, which is like a game changer and is really cool. So it's not the answer in and of itself, but it's an important success to be able to celebrate and remember. And I just want to leave on the last one a quick quote that I've been sharing with community partners as well, and from someone who has lots of experience in championing and being an advocate for children, especially, is just a reminder that I think we have an obligation to be part of this change, and that it takes sort of doing it one step at a time. So thank you so much.
Thank you, Amy. And you got some comments in the chat for, just appreciation for leaning into the insights and sharing them. So thank you for that. And so I want to engage in a conversation for a few minutes with Becca and Amy. And if I hope the two of you don't mind, but I'm going to take the liberty of asking some of the questions that have surfaced already in the Q&A box. And first, before we go to any of the more meaty questions, I wanted to respond to a question from Deidre. And she says, I'm a newbie. What characterizes a 2Gen program? And I know that Sarah Esterly responded in the chat, but I also wanted to get some insights from Amy and Becca. But first, I wanted to share that at Ascend, we no longer use the terminology a two-generation program. If you notice throughout my presentation, I use the term two-generation approach because we believe that in order to do this work really well, you have to have some conditions, internal systems. So we say that you're either a two-generation organization or you're a two-generation system, that you can't have a standalone program within an entity. So with that, Raimi, I'm going to just open it up to Becca or Amy. How would you like to define your two-generation approach? How do you use it? How do you share that with your partners?
I typically introduce it as if you're serving an individual, recognizing that that individual has a household and adults made to be a caretaker of children or a caretaker of older dependents, and that children have caretakers. All children have caretakers. And so just recognizing that however you're entering into that family household and serving that family, that there are other folks in that family, and that the best way of getting the person you're working with out of poverty is to take into consideration everyone else in their household and their caretaker.
Wonderful. Thank you, Becca. Amy, anything to add?
Very similar when it comes to the definition, and similarly, we really emphasize the need to build we use the term family-centered, but ecosystems that can support families. So recognizing that even if you are a community partner that might have a very specific specialty, that not only, as Becca said, can you consider how to be family-centered in your own work, but you can think about your role as being part of an ecosystem to support family well-being.
Wonderful, thank you. And so there's another question from Anonymous. It says, what do you do when you receive resistance to the two-generation approach from stakeholders, individuals that believe caregivers should pull themselves up by their bootstraps? Amy, you want to lean into that one first?
Yeah, we've been working, I think leaning into some of the great framing work to make sure that we're sort of describing well-being, not just as individual success, but recognizing that it's like building a house. It takes a lot of different elements and supports and expertise coming together at the right time to build not only solid foundations, but help families weather challenges. So framing even individual success within the context of neighborhood and community and systems. And so that's often what we've found is helpful, is to shift the focus to really saying, for families to be well and to be able to reach those milestones, we need to have really strong and supportive communities, and we need to have systems that help really enable that success as well.
Wonderful. Becca, anything to add?
I think my response to this is just that not everyone has boots with bootstraps. Some people have boots, but they don't have laces. Some people don't have boots at all. And so when we're thinking about pulling yourself up with your bootstraps, we have to think about whether or not folks even have the bootstraps to begin with. And I think that's what we're trying to get it to a place where everyone is standing on the same feet with the same boots and the same bootstraps, and giving them the ability and the agency to go in the direction, pull themselves in the direction where they want to be. And so assuming that everyone has bootstraps to pull on is something that I would question.
Wonderful, wonderful. So questioning the assumptions of what the starting point with people are. Ascend actually developed, some framing and messaging around the importance of a two-generation approach. And I'll be happy to put, a link in the chat to those resources. Because another question that has come in the chat is, what are the internal systems that you need to have to support this approach? And then also, this is from Bill Fletcher, with 30 or more entities connected in the strategy, how do you assure alignment of services? And I would add quality of services as well.
So I can jump in a little bit. I mean, I think especially from a United Way perspective, we've had to really shift a lot of internal processes around how we internally collaborate, even some basics, like how do we understand who we're connected with, our relationship management with community partners, so that we can really move to a more relational engagement and not be transactional. I think it also for us required being really internally honest about narratives that our organization has held in the community and behaviors that have created and supported those narratives, so that we could actively say, how do as an organization we change those behaviors, many of which is how we show up on a daily basis in community with our team members. So I think there's a lot of internal practices. I think strategy alignment is one that I lose a lot of sleep over, and would say that this is where building that shared vision and really being able to anchor on shared principles is so critical to then aligning that strategy, because you can't control everything, and you really have to have those relationships and alignment around values and vision to be able to work on that strategy alignment.
Wonderful, thank you. Becca?
I totally agree with Amy, and I just want to add that we are constantly still trying to improve our policies and processes to do this work better. One of the biggest things for 2Gen, which I do see our organization as a 2Gen organization outside of Justice Coalition or it's Justice Work, is making it so that we are really elevating and listening to community voice. And that doesn't just mean getting feedback or getting input, and it doesn't mean getting input and then making a decision in a different space without community voice present. And that's something that it's really been a shift, and we're still working on it. But that's going to be a key practice. And are you being willing to value the opinions and the voice and how folks define well-being for themselves, and shifting your work to align with that rather than trying to make what they say fit into work that's already been outlined.
Wonderful, thank you. So I'm going to combine a couple of questions given time. And Becca Titus asked, how do we get started if we don't have any of this in place? We are just plugging into community foundation and entities to get United Way a seat at the table. So I'm going to combine that with how do you get started with also, there was a question about how do you engage school systems? And then what about mental health services? So you could talk to each one of those in your response. That would be great. And Becca, would you like to go first?
Sure. So in terms of how you get started, I think it really depends on your community. And I want to note that we are doing 2Gen in 3 different ways. We have a community coalition. We have grants that we give out to other 2Gen organizations. And we also are piloting some 2Gen programs out of our United Way. So there are several ways to do this work. So whatever, might be a logical first step for you all. And I think the essential point is just no matter how you're doing 2Gen, to be talking about it as 2Gen, and to be really sharing that wisdom, because that's where we've seen the most impact, is just by spreading the conversation of 2Gen.
Great, thank you. Thank you. I also put in in my slide deck community continuum so that you can assess where your community is as you start to do a 2-generation approach. But Becca, were you going to add something else?
I was trying to remember the other 2 parts of
the other 2 questions was about school systems as well as mental health supports and services.
Amy, I don't know if you could maybe speak to school systems better than I can.
I can, I think community context matters. We in our area have a really predominant one large school system and then a series of very small independent school systems. In one of my insights, I think it's that you got to lean into your early adopters. And we've had challenges with that with our school systems. I mean, as you all know, they're overwhelmed with lots of priorities. So with them, what we've been really intentional about is finding opportunities for sort of transactional trust building to really diversify our relationships with them, and then hopefully bring them in, but have been leaning in more, closely with community partners that are sort of better positioned to quickly activate around embedding 2Gen into their work. So it's sort of a two-prong approach, which is like, how do we bring them along and continue to make progress with partners that are jumping in.
Wonderful.
Yeah.
Thank you.
Mhm.
And Amy, there's a question specifically for you, and it's please share an example of hitting a dip from your key insights and what strategies you use to work through it. What strategies you use to work through it.
Yeah, I would say like right now we're in a little bit of a dip right now. It can feel like it after working for a year with some of our community partners on these bigger system change challenges. And that dip is showing up as a lot of frustration that folks feel like we haven't done as much as we should have, and feeling that people are not showing up in the right way. And working through it, I think, is again about relationships. It's a lot of individual conversations right now. But I think it's recognizing that frustration can be good, right? It's not negative feedback. Those are your champions that want to see change. So leaning into them and saying, okay, what can we do? What should we do? How do we talk about this differently to be able to work back through it?
Wonderful, wonderful. I really wanted to go back to the question around mental health just a little bit. Do you have partners within your networks that support the mental health and well-being, specifically of families? Becca?
We do. We have partners who have family therapists or other kind of folks in that profession who work with the families that they work with. So I'm trying to think of more specific, but the short answer is yes. And I think mental health support is something that absolutely should be centered in 2Gen. And I would also add that it's something that is not as centered as some of the other gears. And so I'm really glad that someone highlighted that.
Thank you. Amy, anything to add?
Yeah, I would add on to that. I mean, we actually have a group right now that are wrestling with how, as a system, especially around behavioral and mental health, can you get more preventative for family care? And I think that that's a system that is very much based off of reactive responding in times of crisis, just how systems are set up with reimbursement rates. And so I think it's a great a sector to say, really, where are there policies and sort of practices that need to be shifted to help the providers work more holistically and upstream with families instead of in those reactive, typically individualized services.
Yeah, wonderful. Thank you. I'll add two things here. One of the things that Ascend worked on early is what is, usually a challenge right after, families, have a baby. There could be postpartum depression, within the family. And there is an opportunity for dyadic treatment of both babies and the adult caregiver, the parent. If a child is, receiving Medicaid payment, oftentimes maybe the mom is not, but there are provisions within Medicaid that will allow for, a child's Medicaid be billed for, screening and treatment of the mom. And that uniquely is a 2-generation approach, right? Making certain that you're caring for the child, but what does the mom need if there are symptoms of depression, that pediatrician can refer that mom for screening and get some supports. That's really important. The other thing that I will share is that recently we've been in conversation with family therapists, right? When you think about 2-generation or whole family approaches, family therapy is another, sector system that we need to engage in this work to understand, what lessons they've learned about working with families over the years that might be applicable to the work that we're doing, both at the community level and then systems change and policy level. And what's really important about 2-generation approaches is this mutual motivation. When you support both the child and the adult caregiver parent at the same time, you'll find that they're reinforcing each other's positive behaviors. If parents are in thriving environments, they're more likely to make certain that their children are, well cared for. Thriving children in thriving environments also are inspired by their parents. So recognizing that this term mutual motivation, which was actually coined by an Ascend Fellow, Dr. Lindsay Chase Lansdale, is what we're trying to make certain is inherent and supported in families. And, mental health supports and services are an important component of doing that. So what I would like to do now is open it up to our other panelists. And I know that, Camille, there were a couple of questions in the Q&A that you responded to, but I'm curious if there are any reflections that you would like to share, with the broader group during this time.
Sure. No, thanks very much for that. The couple of questions I got, one was, well-being is not really a way of thinking about how people get ahead across the world. That was one. And the second one was around whether or not people should really be getting something like universal basic income. Isn't that more of a handout, et cetera? So I can address both of those in turn. In terms of the well-being framing, actually, the social development goals of 2025, those are all very much based on the concept of well-being. So when you think, look across the globe and you think about policies that have to do with providing access to education or access to basic health care, even income generating strategies, all of those are really based on the principle of well-being. So that's across the globe. And then with respect to universal basic income, the question was, how does that actually promote family agency? And isn't that an entitlement? And shouldn't we be moving away from entitlement? So universal basic income, those strategies, the way they've been practiced here in the US, and there have been a variety of different versions of that, but almost all of them provide cash to families, and the families then figure out how best to use the cash. So for whatever purposes best meet their needs. And so in not specifying exactly what the cash is supposed to be used for, you then, allow families to just act like any other family and have agency to direct their funds where they're most needed. So there's is a very significant amount of validated evidence with respect to that approach. And then with respect to whether or not it's a handout and doesn't, it sort of in some ways flies in the face of a framing where people are deserving and not deserving. I think probably where we need to start that discussion is what are the assumptions upon which we decide that some people are deserving and some people aren't. So I would that's how I would engage our questioner, and happy to get any feedback on that as well.
Wonderful. Thank you. Thank you very much, Camille. And I am just going to open it up to Amy, Becca, for any closing remarks before I turn it back over to Ralph and Aola for their closing remarks. Any connections, reflections you'd like to make?
I just want to make sure, because this was not explicit, that all of that our journey has been inspired by so many, and we have learned from so many others within the United Way network and nationally within networks that we've been part of. So I just wanted to acknowledge that I think as a collective, we are so strong. So this really excites me to be able to be part of platforms that are helping us learn and share together.
Wonderful, thank you. Becca?
I was thinking along the same vein, Amy, I look forward to all the work that everyone in this group does. There's so much more to be learned. And I also want to credit the 2Gen programs and partners who had been doing work in Austin for a long time before United Way started talking about 2Gen. And there's so many of those programs and that work out there being done.
Wonderful, thank you. Thank you both so much. And Camille, how do people stay in touch with your work?
Sure. I had mentioned, and I think there were some questions around this, a project that I'm doing currently that's really having communities lead a discussion about what it means to experience well-being. We're actually just in the process, and so we're kind of in a really exciting phase, so we don't have all the data yet. We expect everything to be finished up by the end of 2024, which sounds like a long time, but we're being really careful in consulting and building trust with our community leaders. But you can always keep track of us at Brookings, BROOKINGS.edu. And you can look me up, or you can just, look at brookings.edu.
Thank you so much. And deep appreciation to everyone for joining this conversation. If you're interested in learning more about the 2-generation approach, welcome you to join the Ascend Network. And just final thank you, Ralph and Aola. This has been a wonderful opportunity, and much appreciation to the Campaign for Grade Level Reading and United Way Worldwide. So back to you, Ralph. Thank you.
Well, I am going to end by handing it back to Aola, but I must say that, have you been to these conferences where they say, okay, you got one word? My one word is inspired. And then I thank you. Aola, back to you.
Thank you, Ralph. And I want to thank everybody for the great turnout, for joining us in the conversation today, and to my colleagues, Becca and Amy, and sharing and reflecting on their work, as well as to Camille for really setting the table and raising the level of conversation in terms of what we should be aspiring to as a country and as communities across this country. And to challenge us to continue to raise the bar for ourselves in terms of the work that we do with and for our communities across the United States, which 2Gen being a premier approach within that, to achieve the kind of systemic change that we think will change the trajectory for families across this nation. So thank you all so much. Please stay tuned. This is the first webinar in a series that we're doing with our partners at the campaign, with Ralph and his team. And so we will be circling back to provide you opportunity to register for those follow-on webinars. So have a great rest of your Campaign for Grade Level Reading Week, and we will see you soon in September. Take care, everybody.
Thank you.
Thank you.